For this lab, you'll be working on the isolated hind end of the bovine. So we're looking at the calf here, and we're looking at the left side, and so you're going to have to remove the left half of the pelvis. And to do that, you're going to use a striker saw, and you're going to cut through the shaft of the ilium, so you're going right ventral to the wing of the ilium here, and you're going to make a cut through the shaft of the ilium of the pelvis. And then you're going to have to expose the pelvic symphysis on the midline. So that means you'll have to remove some of this adductor muscle here and expose that pelvic symphysis. And then you're going to cut through that as well, and then all the way through here, which also means you need to cut through the left crus of your penis. So you need to remove that from the left side and just push everything over to the right side. So then you're going to make those cuts, and you'll actually take off the left half of the pelvis. So you'll have to cut around the parts of the pelvis to get it all the way off. So you want to cut through that soft tissue and then remove this part. So after you do that, you're going to work on some of the vessels, and I just want to note that you want to be very careful when you remove that pelvis, because as you can see here, I cut through my vessel, so you don't want to do that if possible. And I sutured it back together, so hopefully I can still show it to you. But you want to be really careful when you're cutting away that hemipelvis when you're on the left side here. All right, so we're going to start within the pelvis, so I'm going to flip this over so that you can see the inside. So here we're going to just quickly review. We did the external iliac arteries previously, and now we're going to work on the internal iliac arteries. So here's an internal iliac artery on the left side. Here would be our internal iliac artery on the right side, and then here in the bovine you have that median sacral artery. So on the internal iliac, you're going to dissect that inside the pelvis, and you're going to find the umbilical artery first. And usually it's very large, and it's going toward the bladder. So this would be the umbilical artery, and you can trace it down to the bladder, which you can see right here. Then you're going to follow the internal iliac, and it's a little bit different in the branching pattern than it is in the equine. And so you're going to follow it inside, and then you're going to continue outside of the pelvis where we just took that half of the pelvis off so that you can see it a little bit easier. I'm not sure that you'll be able to see where this is coming off, but I'll try and elevate it with the probe. So here you would have it's called an iliolumbar, and it's just a small branch coming off. And then you would also have your cranial gluteal coming off of internal iliac here as well. And I'm actually just going to stick the probe through, and then we're going to turn it to the lateral side, and you can see where the probe is coming out. That's where that cranial gluteal artery is coming through. So that's coming out of the greater sciatic foramen with that sciatic nerve there. So cranial gluteal artery here, and then on this side we're going to continue to follow the internal iliac right here. So in the bovine, the split into the caudal gluteal and internal pudendal is much farther caudally than in the equine. So you need to continue to follow this internal iliac all the way back. And then you'll look for what would be the urogenital artery, and in the case of the calves, they're all boys, so you would have a prostatic in all of these male calves. So prostatic artery here. Then you continue to follow it, and once you're at the level of that lesser sciatic foramen, you're going to get your split into your caudal gluteal artery and your internal pudendal artery. So then internal pudendal, again, is the one I cut and had to stitch back together here. But if you follow that, it's very similar to the dog branching pattern. And so the internal pudendal will come out and give an artery to the caudal rectal, so it'll go into the external anal sphincter. You'll get a ventral perineal, and then you'll also get the artery of the penis. So that would be right here. Then that will give off a couple of deep branches and then continue as the dorsal artery of the penis right here. And in this poor little calf, it's pretty chopped up down here, so it's hard to trace that all the way down. Also right here, I want to point out while we're right there, you would also have the dorsal nerve of the penis, which is right here, and that would come off of the pudendal nerve, which is going to run in that same area here. All right, so now we'll take a look at some of the genitalia structures. And I think we're going to do this from the lateral side because I think the view is actually better. So I'm just going to try and tip it a little bit so you can see all of this stuff. So the orientation may be a little strange for you here. but I'm going to try and elevate these so you can see. You would have your Ductus Deferens from either side. So here would be a Ductus Deferens, and here would be a Ductus Deferens on the other side. And those are coming here to these enlargements of the Ductus Deferens, which are called the ampulla, or ampullae would be plural, I suppose. So here are the ampullae right here. And this little fold in between where you have those two Ductus Deferens is the genital fold right there. Then we come down here and we're going to see the vesicular glands. So here they're kind of lobulated looking, this tissue right here. So vesicular gland and a vesicular gland over on that side. And then the prostate in the bovine is extremely small. So it's kind of this little bump right here. And that's all there is to the prostate in the bovine. So it's very, very small. Then the striated muscle you're seeing here is the urethralis muscle that's covering the urethra. And then they would also have very, very small bulbourethral glands, but I couldn't really even find them on this one, so you don't have to find those in your calf specimens. All right, then we'll move on and look at the penis. And we're going to take a look at the different parts of the penis. So we have the root, the body, and the free part. And the root of the penis is basically this part right here, where you have your two crura. So you'll have a crus on the left and a crus on the right. And those come together here. And this part of the penis is the root of the penis that includes the bulb of the penis. So the bulb is here. You have your crura on either side. Where the crura meet, then you start to get into where the body is. So the body would be extending from here down to the free part. And so this is kind of chopped here, so it's hard to follow. But you would also then have the free part would be extending distally once you get further down. However, on the calves, they have had prior surgeries in this area, so it makes it really difficult to appreciate all these different parts, but I'll show you everything that I can. So now we're going to look a little bit more of a caudal view here. Try and piece this guy back together. So as I mentioned, you have a crura on either side. So you have crura, plural, on either side. So you have a left crus and a right crus. So here would be the right crus, and this would be the left crus. And each of those is covered with this ischiocavernosus muscle. So that's the muscle you're seeing here on either side, is ischiocavernosus muscle. And then the crus itself is composed of an erectile tissue, the corpus cavernosum penis, and that's surrounded by the tunica albuginea. So we cut open, I'll flip it over again here. We cut open the left crus so that you could see some of that erectile tissue inside. And so this part is going to be the erectile tissue. And then the surrounding, the white, thick, surrounding fibrous part is the tunica albuginea. And so the corpus cavernosum penis is the erectile tissue surrounded by tunica albuginea, and those make up the crus. Then the crus is covered by the ischiocavernosus muscle. Then on the bulb of the penis, we're going to have a muscle covering an erectile tissue as well. So this is the retractor penis muscle that we talked about before, and I'm just going to reflect it to be able to show you the bulb here a little bit better. So here's the bulb of the penis, and it would be covered by the bulbospongiosus muscle, is the muscle covering the exterior. And then when we cut it open, we can show you inside we have the corpus spongiosum erectile tissue. So corpus spongiosum erectile tissue would be in there. And then you would have your urethra would be running through the middle. So you have the hole. So if I stick the probe in it, that's the urethra. And then on this side, the urethra continues right there. So the bulbospongiosus muscle is the muscle exterior. Then you have the corpus spongiosum erectile tissue surrounding the urethra. What else can I show you? Great. Okay, we'll move on to a little bit about the body of the penis here, which is cut, so it's hard to show you, but I do want to try and show you the sigmoid flexure because that's unique to the bovine. And so here, I have my retractor penis muscle that I've dissected out. And if I pull on that, you can actually see it kind of take the shape of the sigmoid flexure again. That shape was taken out when they did the surgery and they repositioned the penis. So we want to just kind of pull on this to see that shape again. And so this is the sigmoid flexure in the bovine penis. It has a proximal loop, which would be the first loop, and a distal loop, which is the second loop here. And notice that the retractor penis is pulling on that distal loop and not on the proximal loop. So sigmoid flexure, proximal loop, distal loop. I think that's all I can show you on that. So now we'll move on and just look quickly at the testes. And so here on the left side, I've taken out the testicle, and I've kind of dissected away the different parts. So we looked at this before, but we saw the Cree master muscle, which is the muscle coming off the caudal edge of the internal abdominal oblique. And so Cree master muscle is there. And I've cut open the vaginal tunic. So here you would have the vaginal tunic opened up. And so I have parietal vaginal tunic would be here, so that's the wall. Then I would have visceral vaginal tunic that's tightly adhered to the testis itself and the epididymis and the ductus deferens. So visceral vaginal tunic, parietal vaginal tunic lines the wall, and that's what you're cutting open to get into this space. Then you also want to see the parts that are connecting to the ductus deferens and the testicular artery and vein. So when I open this up, I can see the testicular artery and vein are right here. And so the connecting part here that's connected to those, so this part of the tunic is the mesorchium. Then connecting to the ductus deferens over here, you would have mesoductus deferens right here. Then we'll move down and take a look at the epididymis. So if you position it how it would be in the body, the head of the epididymis is always facing the head of the animal. So the head of the epididymis is here. Then we would have a body. So if you take this all the way out here, we have the body of the epididymis and then the tail of the epididymis. Then if you flip it over to the medial side, then you'll see the ductus deferens. So here we have ductus deferens that's communicating with the tail of the epididymis here. Now on the lateral side, you'll have the testicular bursa. So that's where I'm sticking the probe in. And that's always going to be on the lateral side. So that, along with the head and tail of the epididymis, should be able to help you differentiate a left from a right testicle, if you should have to. So on the lateral side, testicular bursa, head of the epididymis always faces the head of the animal, tail of the epididymis always is going toward the tail of the animal. The last few structures we need to show you are in the pelvic region inside. And I want to flip it over and just show you a couple of things. Now in the bovine, if you look where the external iliac arteries are coming off, you see where the deep circumflex iliac artery is coming off, and then you'll see very large lymph nodes right in that area. And those are called the external iliac lymph nodes. So you want to look for those. They're usually fairly large, so they're easy to see. You can see them on this side as well. Then on the right side of the animal, you can also trace out all of those arteries that we did on the left side. And so you're going to just follow the internal iliac on the right side as well. You'll look for the umbilical, which is that first branch. You'll follow it, try and see a cranial gluteal coming off, and then trace it as far as you can. Then once you're on the lateral side, you can find where the caudal gluteal and internal pudendal branch. So I'll show you that in just a moment. But first, so while you're inside the pelvis, there's a couple of nerves you want to look for, and one of them is the obturator nerve. So you're seeing that right here. And we'll see that again. I'll show you another view of that as well. But that's the obturator nerve. And then you're also supposed to look for the roots of the sciatic nerve, which are coming from L6, S1, and S2. And so those are going to be deep down in here. And so they're very hard to see, but if you find them, I'm going to flip it over to the lateral side so I can show you that my probe is sticking through where the sciatic nerve comes out. So you can see my probe is right there. So the roots of those are what you're looking for inside the pelvis, and then you want to trace them out to where they come out to form the sciatic nerve right here. So the sciatic nerve is very large and should be very obvious. So you want to see that. And then also in this region you can see on the right side your craniogluteal artery is coming out here as well. And then you can find the continuation of what would be your caudal gluteal artery here and that internal pudendal. So here's that branching point into caudal gluteal and internal pudendal on the right side. The other nerve that you can look for is the femoral nerve on this side. And so I'm going to flip this over towards you. So here you're looking more at a cranial view onto the medial side of the thigh. And when you're looking at that area, you can try to look for the femoral nerve, which is this large branch that comes out and then kind of branches off everywhere into the muscles. So this is going to be that femoral nerve. So you can look for that. And then also, from this side, you can see the obturator nerve again, and it may be easier to find if you try going through the hole that you made rather than inside the pelvis. Now if you want to look for the obturator nerve from this hole that you made by removing the pelvis, you can do that, and it might be a little bit easier, or you may be able to just trace it easier. And so you're seeing that obturator nerve right here. This would be the right side, the right obturator nerve. And that's going through the obturator foramen of the pelvis on the right side.